yeah? Who can play that game?
Where did he get a gun from? Doctor versus Doug, Mickey Mantle disease, and somebody's definitely losing an eye. Today we're back at it, breaking down and reacting to the possibly offensive medical scenes and head-shaking injuries from Family Guy number 20. Let's dive right in.
Chris, where the hell are we?
I told you, Doug. This is the bacon factory.
Doug.
Doctor, I need you to get rid of this zit.
You traitor!
What is a zit? Increase in oils of the skin that might get trapped underneath. It can form a small little pocket of pus or pustule. I deal with these in the emergency department when they become more like an abscess.
Oh, that's a doozy. I bet some of those awful kids at school call you Zit Face.
No.
Papa Zit.
No.
Pus Peak.
No.
Fat.
Oh, yeah.
Oh, that's terrible.
What do you guys call pimples? Let me know in the comments. I didn't hear about half of these ever in my life.
Well, we're going to have to use some cortisone on that.
Ah, so this is actually pretty good. Cortisone is a type of steroid. Steroids to decrease inflammation.
Oh, yeah? Who can play that game?
Where did he get a gun from? Oh. It doesn't go away that fast. It will help it go away. Sometimes it increases the risk of getting infection. Just something to be aware of.
You okay, Fat?
Whoa! Doctors calling your patients names. No, you cannot do that.
Ryan, your blood work shows that your liver isn't functioning properly.
There's lots of different liver function tests that we do. We're looking at your AST and your ALT, your different blood coagulation levels, as well as some more in-depth blood tests.
Would you happen to be a drinker?
The liver helps process toxins in our bodies. We know that if you drink too much alcohol, it causes issues relating to damage to your liver, leading to cirrhosis. But there are a lot of other things out there that can cause your liver function test to go high.
Well, I don't know if I'd label myself a drinker. I know I like a cold beer after I mow the lawn.
There were 3 lies in that sentence.
Be honest with your doctors. If you're ever going to the doctor about how much you drink, you can't really hide it from the doctor. You can also test alcohol levels even if you're currently drinking.
Ryan, have you ever heard of Lou Gehrig's disease?
So Lou Gehrig's disease is also called ALS. It is a nervous system disease that weakens muscles and impacts physical function. It's typically kind of from the top down.
Well, you have Mickey Mantle's disease.
Mickey Mantle has been treated for alcoholism, so he's trying to tell Brian that he's an alcoholic. We've actually determined scientifically that there is really no true health benefit to alcohol. So just be aware of that. Every time you're putting it in your body, it is like a toxin.
Now, the most obvious step would simply be to stop drinking.
We do have medications to help that. Benzodiazepines, sometimes we use Librium. A lot of this needs to be monitored by your doctor.
Or, well, we do have these pills that may correct the enzyme imbalance in your liver.
If somebody's an alcoholic and they drink every day, quitting drinking right away could be dangerous, can set off alcohol withdrawal syndrome, hypertension, tachycardia, shakiness, which could also lead to seizures and could lead to death.
Yeah, that one. Okay, I'll be in the waiting room barking at the fish in the tank.
If you're just the occasional social drinker, but you don't want to wake up feeling bad the next day, I've created a supplement called Poor Decisions.
All right, Mr. Griffin, these pills will clear up Brian's condition. But unfortunately, they only come in suppository form.
Suppository meaning a medication that needs to go into your rectum, through the anus, so that way they get absorbed down there. Sometimes suppositories are better. If you're vomiting and you can't actually ingest anything, this is a way to get it into your body. And it also has first line pass into the liver.
It's nice to watch TV when you have nothing else to do, isn't it?
Yeah.
Get over here, you idiot!
Stop! Peter, what the hell?
I'm still in charge of you!
Stop it!
I'm a human!
Get away from me!
This is for your benefit, so just go limp and
You
take
touch
it!
my ass! I swear to God, I'll kill you!
You can't really force patients to take medication. The only time that really does occur is if the individual is a danger to themselves or a danger to others and you're actually trying to help them.
Ah!
Oh!
What the hell? You bit me!
We get a lot of people that come to the emergency department for dog bite injuries, and we worry about infections because of the puncture wounds. Obviously, we'll close up any wounds if they're gaping. If they're just slightly open, sometimes we leave them open to prevent infection.
Holy crap, a vintage Mr. Potato Head from the good old days when potatoes were men and had penises.
What does that even mean?
That's the very potato I used in medical school to learn anatomy. I could let it go for 600.
In medical school, when you're actually studying human anatomy, you're doing a cadaveric lab, so you're doing dissections. In the med school that I went to, we actually had 4 individuals to a single cadaver.
We don't have that kind of money.
Fine, I'll buy it with my magic beans.
Those are Skittles.
Pretty intense anatomy in medical school. Not where you would use Mr. Potato Head.
I wish I had a jetpack. My life would be better.
Oh, geez, dangerous.
Ooh, 360.
360 pounds, not good. Carrying that much weight increases cardiovascular risk of death. So please be aware of that. Eating healthy, losing weight are things that we can do, as well as exercise.
Oh, wait, 180.
Every time you go to a doctor's office, even the ER too, we need a height and a weight. And the reason for this is it's helpful for us with medications because there's a lot of weight-based medications. A lot of them are milligram per kilogram.
Very good. Now let's get your height. All right, so you're 7'6", 180 with colorectal cancer.
I'm tall?
Oh my gosh. Colorectal cancer, colon, rectum. These are cancers that we can screen for doing a colonoscopy, which is highly recommended, especially here in the United States. Make sure that you get them. They've actually lowered the age to 45 to start screening. If you can catch it early, it is quite treatable.
Okay, here it comes.
Oh my God! He farted, right? Sounded like he had a fart. So either had diarrhea or bloody diarrhea. Sometimes people are so worried that they have blood in their stool, but it's just a fissure, which is just a cut in the anus, or an internal or external hemorrhoid, because they both can bleed, but internal ones bleed a lot.
Peter, what's wrong with you?
The big bleeds that we worry about is when it's mixed in with the stool, not necessarily on the outside of the stool, but if it's mixed in or if it's all blood, not good. Typically, if you have blood in your intestine, in your colon, the intestines don't like it, so they're actually going to cause you to have diarrhea and get it out.
Brown? Oh, gross, like pee?
If somebody is bleeding bright red and they had a peptic ulcer, the person may not have a very much longer time period to live because they're bleeding out so quickly. So very much an emergency. That's when we call a GI specialist, a gastroenterologist, to come emergently do an upper endoscopy and see if there's a source of the bleeding that they can stop.
Okay, guys, now you're gonna do a synchronized duet of making whoopee while I shoot you with this BB gun.
Please be careful. BB guns are quite dangerous.
The BB gun.
I've actually seen BBs go through people's skin and get stuck under there or get stuck into their soft tissue and you can't get them out and then you have to be stuck with them for a while.
Hey, Joe, open your eye.
I've actually seen people get shot in the eyeball with a BB. You can actually go blind. When it ruptures the globe, all the fluid of the eye gets squished out of there. The concern is the optic nerve being damaged as well as the retina, which is the area in the backs of the eye that help us see.
You know, Peter, you used to be a great guy, but ever since you won that lottery...
Hitting somebody in the throat like that, super small, could it go through the airway? Maybe if there was enough force, but you're also causing a little bit of trauma and swelling to this area. So if you're actually hitting the airway and your vocal cords, it could potentially cause swelling on the inside and actually cause the airway to close up. Family Guy, they continue to have such good medical topics for us to talk about. I know there's going to be more, but if you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.